listening to Planet Vero Radio. I am Cindy Schwartz, and this is Patient Partners. And I have with me my co-host on the phone, Jeannie Roller. She is on, I said the phone on Skype. She is in Indiana. Jeannie, you're doing okay today. We're going to talk. We're going to go right to it. I'm going to go to you. We're going to talk about nursing home abuse and what's going on with nursing homes. And I'm just going to start right off by saying the people that I've talked with in the medical field say, yeah, it's the abuses that we've heard. Hopefully we won't hear more, but because of the COVID, there has been no one really going into the nursing homes to check on these people because they can't check. And so the stuff that we're hearing is it's just abysmal. It's horrible. It's just awful. So I'm going to let you take the reins on this, Jeannie, and then I'll add a couple of things that I know about it. So go ahead.
Okay. Well, first I wanted to say that the elderly in general are the bread and butter of the medical community. They are the ones who have the majority of medical care, prescription drugs, and long-term care facilities, which we call nursing homes. Mm-hmm. It is pretty often that I have seen as a person going into a nursing home and seeing people just sitting there unattended, kind of falling over in their chairs, calling out for help. I mean, as a young child, I was so disturbed by that. I can't tell you how disturbing it was, that this happens so often. And I wanted to address some things that most people may not think about, and that is unnecessary exposure of a resident. Now, that is pretty serious because I have talked to several nursing home workers, and they say that this is pretty common. They say it's pretty commonplace for a resident to be undressed in front of an open door that anyone going up or down the hall can look in and see that resident in a state of nudity. Mm-hmm. One told me that one time she walked into a room where a resident was undressed in front of an open window, and workers outside doing lawn work or something were just staring in the window at the resident. That is appalling. That is absolutely uncalled for. It seems to be a lack of respect for our elderly. I don't know if these people are trained on how to take care of the elderly. I have no clue, but you would think that they would have training.
Well, it kind of goes along with what we've talked about on other segments, that they tell you it doesn't matter, you're under anesthesia because you're so drugged up. So you don't have your wherewithal, but you're supposed to still be treated as a human being regardless if you're drugged up. And the same goes with nursing home residents that have dementia or Alzheimer's. They're human beings.
Well, yes, they are. And it doesn't really matter if they are or aren't in the state of dementia, because they're doing it to everyone. Anyone who needs help, they're doing it to. Even if, like if you're wheelchair bound, these people suffer the same consequences. I've also been in nursing homes where I have seen male workers helping female residents to the bathroom, going in there and being the only one present, and vice versa, where a female worker is the only one helping a male resident. I mean, it is just an open opportunity for sexual abuse. This should not be happening. It is so wrong. And the thing I read in an article is that many of these residents, they are afraid to speak up. They're terrified. They feel bullied. They feel, I guess, just alone in the world. And they don't speak up about the abuse that they're suffering. So we have really no idea how much of this type of abuse is going on. And that is so disturbing to me, that there are no guards in place, so to speak, to make sure that this is not happening. I just don't understand. I spoke to a nursing home administrator, and as soon as she saw what I was speaking of, she was like, "We're done." So, I mean, they know it's happening, but they just, again, like with hospital patients, they don't want to talk about it. The
one thing that I do know from my own experience, and this is years ago, most people that I've seen or know of that get put in a nursing home, their family or friends or whatever do not go visit them. So once they're put there, that's exactly what it is. They're put there, and they're forgotten about. Yeah. So my one thing that I do know that I did see, people that go visit their relatives or their friends. I mean, and I understand that people can't take care of people that need extra medical services and whatever. I totally get that. But there should be some way that you can, as the family member, either visit yourself, get somebody, visit the patient themselves, or get somebody to do that, or maybe with a little bit of money, hire somebody. Because the more people that interact with these nursing home residents, the less likelihood that some of this stuff can happen because there's checks and balances. I mean, that's my own personal opinion. I have seen it work, and I have seen where those people that have that get better care, because otherwise it's just, you're right, there's nobody that checks what's going on. There's supposed to be people that do that. There's supposed to be state Medicare guidelines and all of that, but we both know that that's a perfect world. That's not reality.
Well, my husband at 67 was exposed, and when we talked to the hospital administration about it, they said to both of us that he should just get used to it, because as he gets older, he will have more and more medical encounters. So therefore, he should get used to being exposed. So if at 67, he's fully capable. He lives every day of his life like a 30-year-old. If they're telling someone like him that, can you imagine for people who are more defenseless than even he is?
Right.
He was very defenseless at the time.
Right.
Because sedated. But can you imagine that this is probably the same line of thinking that they have in these nursing homes? Well, who cares that these people don't know what's happening, but they do know.
Yeah, they do well, because we're human beings. At the end of the day, whether we're conscious of it or we're not conscious, that's the first thing that should be, and I thought was taught in medical school and in nursing schools and whatever, that you treat that person like they're a viable, which they are, human being, fully present to the circumstances. End of discussion. That's it. That's what you do. You treat them as a human being.
Yes, medical care should not ever rob a person of their dignity. It should never do that. And we have allowed medical care through hospitalization all of our lives to do this, until the point where in the nursing home it is done routinely without thought, and those people really have no way of defending themselves. And it is very sad that our society has allowed this to happen, that someone is just parked in a nursing home waiting to die, and along the way they're greatly abused.
And why is it they are waiting to die? I mean, people still have lives. You can still have a life in a nursing home. It doesn't mean that you're a vegetable, in a coma. And even, I mean, no disrespect to any of that, but you're still living.
Right. But it brings up the next point is, like in the hospital, in order not to deal with people's needs, sometimes sedation is used. And that is also another point, that older people do not snap back from sedation as quickly as a younger person. So using sedation just to keep someone in their bed or in their chair is just wrong beyond wrong. And when I went into nursing homes, and
we've got like a minute left, Jeannie.
I wonder, have they been sedated?
Yeah, well, that used to be the old adage that they did in the mental facilities, where they just threw Thorazine into everybody because they didn't want to deal with anything. Very quickly, I want to say before I cut you off, Jeannie, we also have Misty Roberts as one of our patient partners. She is at patientmodesty.org, and she's also on Facebook at Medical Patient Modesty. Quick, give your Twitter handle, and then we're going to say goodbye.
Rights for Patients.
Okay, so when you're on Twitter, Jeannie Roller at Rights with the numeral 4 Patients, Rights for Patients. And you have been listening to Planet Vero Radio, and you stay tuned.